Okay, folks, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. A reminder that this Zoom virtual briefing is for press only. If you're not a member of the press, please log out and you can watch on one of our live streams, including on PHL Gov TV, which is Comcast Channel 64 and 1164, as well as Verizon Channels 40 and 41. Please be aware that we're changing the order of things today. We're gonna, because of the length of the opening remarks, to ensure that the reporters have sufficient time for questions, we're gonna move Armando's translation to the end of questions at 2 p.m. The Q&A portion will come first, and Spanish language reporters should still go ahead and ask their questions during the regular Q&A portion. Mayor Kenny cannot join us today. He is greeting President Biden, who is arriving at this hour at Philadelphia International Airport. Pinch hitting today for the mayor is Managing Director Tumar Alexander. We have several guest speakers today, and we'll be putting their names and titles in the chat for you. But for now, let's go to Tumar. You have the floor.
Thank you, Mike. Good afternoon, everyone. 1 year ago, COVID-19 arrived in Philadelphia, and our lives were changed forever. A year ago today, we made the difficult but necessary decision to halt all non-essential business activity and government services in order to help slow the spread of COVID-19. And around a week later, on March 25th, we lost the first Philadelphia resident to COVID. As we take time today to mourn the loss of nearly 3,200 Philadelphians who have perished due to this virus, we must also recognize all those who have sacrificed in other ways since the pandemic hit. Medical staff across the city stepped up to save lives despite risk to their own health. First responders and other public safety employees continue to protect residents in the face of great uncertainty. Other essential workers like our pharmacists, grocery clerks, sanitation workers, prison guards, and delivery drivers kept our city running under extremely difficult circumstances. Parents and caregivers prioritize supporting their kids with online learning education, even if it meant losing a job. Each of us has sacrificed something over the last year. We owe it to ourselves and to each other to reflect on that as we mark this solemn anniversary. Several opportunities for reflection have been organized throughout the day today, and we encourage residents to make space for this in their own ways as well. This morning, Mayor Kenny shared his reflections in a video message on social media. At noon, houses of worship were asked to ring bells or display other symbols of remembrance. This evening, the Office of Faith-Based and Interfaith Affairs will host a virtual event that provides an opportunity to consider both what we've lost and what we've learned. And finally, beginning at 7 p.m., buildings across the city will light up in blue in honor of those lost to COVID-19 and to support our frontline workers. I encourage everyone to take time to reflect on the challenges of the past year, as well as our shared moments of hope and joy. As you do, feel free to share them with all of us online using the hashtag #PhillyReflects. A year later, we're not out of the woods yet, but luckily we're making progress on a number of fronts. On behalf of Mayor Kenny, I want to thank every Philadelphian who've done their part to limit the spread of the virus and keep each other safe. Of course, during these past 12 months, the focus has been drawn towards testing, social distancing, and now the vaccine rollout. While so much attention is devoted to protecting our bodies, the city's Department of Behavioral Health and Intellectual Disability Services have been working on a campaign to remind people of the importance of mental health care. Here to discuss the new Boost Your Mind campaign is DBH IDS Commissioner Dr. Jill Bowen. Jill?
Thank you, Tumar. Good afternoon to all. 1 year ago, we were advised that we were safer at home. We thought it would be weeks, then we thought it would be months, and here we are 1 year later. These have been difficult times. This week, the Department of Behavioral Health and Intellectual Disability Services, DBH IDS, is launching Boost Your Mood, a new public awareness campaign that offers a behavioral health booster for the mind while people are focused on getting their COVID-19 vaccines to protect their bodies. The campaign brings information to people through social media and at some of the vaccination sites throughout the city on how to easily access behavioral health services and care. I'm going to share my slides so you can see what this looks like. This is a flyer. You can see that there are numbers to know and places to go, including emergency and non-emergency behavioral health phone numbers, such as the emergency health crisis number 215-685-6440, and the mental health and addiction services member services number 888-545-2600. As well as wellness tips on the flyers that tell you about where to get support and caregiver wellness, youth wellness, and community wellness. Those seeking additional support for children, adults, families, and communities will also be able to use a QR code, which will bring them to a landing page at dbhids.org/boost, where there are links to resources in both English and Spanish, and where you can easily access online tools, including expert blogs, a free mental health self-screening, an extensive packet of downloadable information, and more at dbhids.org/boost. DBHIDS is committed to reducing the stigma of seeking mental health and substance use treatment services. As hopes rise with expanded efforts to distribute the COVID-19 vaccine, we recognize the impact on mental wellness and the importance of raising awareness about the need to take care of yourself and boost your mood. While this campaign will be most visible at vaccination sites, the overall message that it's okay to not be okay in these difficult times and that help is out there extends well beyond COVID-19 and speaks to the multiple layers of trauma impacting Philadelphians every day. The past year of overwhelming stress and anxiety is not limited to the isolation and toll associated with the coronavirus. It also includes the growth of poverty as jobs disappeared and businesses shuttered. It includes parents turning their homes into schoolhouses while trying to make ends meet. And it includes months of civil unrest in the city, along with the plague of increased gun violence, the ongoing overdose crisis, and more. In the year since COVID arrived in Philadelphia, we all have experienced a prolonged trauma of stress, anxiety, isolation, and loss. So it's okay to not be okay. You're not alone. We are here to help. So visit dbhids.org/boost to learn more. Thank you.
Thank you, Dr. Bowen. And for the reporters on this call, we have put into chat a link to the DBHIDS press release, which has all of this information. We would certainly appreciate your help in spreading the word about these resources. Now we're going to switch gears to a presentation regarding the new federal stimulus package. First up is Sarah DeWolf, who is the Recovery Officer for the City of Philadelphia and Deputy Finance Director for Policy and Practice. And Sarah, I'm going to handle the PowerPoint, so bear with me for 1 second.
Great, thanks, Mike.
All right, can you folks see that?
Yes.
Okay.
Okay, and I'll just, I'll indicate to you when it's time to change the slides. Okay, hello everybody, and thank you for the opportunity to present today. As Mike mentioned, my name is Sarah DeWolf, and I'm the Recovery Officer and a Deputy Finance Director for the City of Philadelphia. In my role, I oversee the various federal, state, and local grant funding that the city's received to respond to and recover from COVID-19. Today, I'm going to give you a quick overview of the American Rescue Plan, what it is, and what it means for Philadelphia. Before I move into the slides, I want to note that the information contained in this presentation is preliminary and subject to change. We'll continue to update the public as we learn more about what the plan means for Philadelphia over the coming months. Mike, can you move to the next slide? So the American Rescue Plan is a $1.9 trillion stimulus bill that was passed by Congress and signed into law by President Biden last Thursday, March 11. The bill is the second largest relief package that the federal government has enacted in response to COVID-19 following the CARES Act. Importantly, the bill includes a number of forms of relief for the American people, including direct aid for individuals and families, as well as relief for businesses and nonprofits who have been negatively impacted by the pandemic. The city has been closely following the progress of the bill from its initial proposal in mid-January. Our advocacy has focused on ensuring that local governments like Philadelphia receive direct and flexible funding, including to replace lost revenues resulting from the pandemic. We're pleased to see that the final version of this bill has preserved this funding. Now that the plan has been enacted, federal agencies must comply with required timeframes for administering funding, primarily within 30, 60, or 90 days. While the text of the bill provides some important guidelines for how to administer the funding, many of the details remain to be worked out at the federal or state level. In some places, we have enough information to arrive at estimates for what Philadelphia will receive. But in other places, no one yet has the full picture. We'll learn more in the coming weeks as federal agencies begin to push out regulations, grant guidance, and notices of funding opportunities. We're also in close contact with other cities, and we'll continue to compare notes and share what early information we can obtain. Mike, can you move to the next slide? So this slide just provides a high-level overview of the $1.9 trillion plan and how much is allocated to each category of spending. As you can see, the biggest categories of spending are for direct relief to individuals in the form of stimulus checks and to governments in recognition of the fact that state, local, and tribal governments are at the front lines of the pandemic and were left out of previous funding packages. Other large categories of spending are for the extension of unemployment benefits and the safe reopening of schools. Can you move to the next slide? So the next two slides outline what direct aid the City of Philadelphia as a government agency can expect to receive directly from the federal government through this bill. I'll note again that these are preliminary estimates, subject to change, and reflect what we know at this point, which is still early. As mentioned on the last slide, the bill provides $350 billion in direct funding to state and local governments through U.S. Treasury. Funding to local governments will be allocated in two chunks, with 50% of that funding coming within 60 days of the enactment of the bill and 50% arriving 12 months later. Our current estimate of what Philadelphia will receive as both a city and a county is $1.4 billion. While that's a significant amount of funding, it is one-time funding and has restricted uses, such as for costs related to responding to the pandemic and its economic consequences, and to replace revenue losses relative to projections that were in place before the pandemic. Our Finance Director, Rob Bowe, will talk more about what this means for the city's finances at the end of this presentation. Other expected funding areas are for vaccine-related activities and testing. Note that we have no estimate for Philadelphia at the moment. Reimbursement of eligible costs through FEMA, funding for firefighters and other first responders. Mike, can you move to the next slide? Emergency rental assistance, housing, and supportive services for homeless populations. Note that our current estimate for that is $42.6 million for Philadelphia. Broadband reimbursement and relief and payroll support for airports. To reiterate, these are funding sources that we expect to receive directly. There may be additional funding opportunities made available through the Commonwealth, but we won't have a sense of what those opportunities are for some time. Can you move to the next slide? Thank you. So in addition to the city, other institutions in Philadelphia can also expect to receive funding directly from the federal government. The bill provides funding for the safe reopening of K through 12 schools. We're currently estimating that the district will receive $1.3 billion through this funding, as well as for reimbursement of expenses to provide internet services. The ARP also provides $4 billion nationally to institutions of higher education to help make up for lost revenue, and provides funding to transit agencies for operating expenses and costs to maintain service due to lost revenue caused by the pandemic. Can you move to the next slide? Lastly, the bill provides $5 billion in funding for housing vouchers, which will go to public housing agencies like PHA and for housing counseling. I'll pause here to just briefly note that these are examples and not an exhaustive list. Can you move to the next slide? So this next slide outlines what assistance can be expected for individuals and families. The bill provides for stimulus checks of up to $1,400 for individuals earning up to $75,000, and for joint filers earning up to $150,000, providing important direct relief to Americans impacted by the pandemic. We're estimating that more than 1 million Philadelphians will be eligible for this relief based on income, which is a very large percentage of our population. The ARP also extends pandemic unemployment through September 6, 2021, a critical extension beyond the mid-March deadline that was looming. The bill also provides an important provision for families with children, expanding the child tax credit by increasing the amount, eliminating the requirement that families must have taxable earnings of at least $2,500, making the credit fully refundable for tax year 2021, and providing advance payments beginning in July. We're estimating that around 300,000 Philadelphia children will be eligible, or more than 90% of our kids. Other benefits include EITC expansion, expanded benefits access, and food access, making both the Affordable Care Act, Obamacare subsidies, and COBRA more affordable, and as previously mentioned, providing rental assistance and homeowner assistance to help keep individuals and families in their homes, as well as providing utility assistance. Can you move to the next slide? Businesses will also be eligible to receive direct funding through the ARP. The bill creates a restaurant revitalization fund, setting aside $28.6 billion in grant funding for restaurants experiencing pandemic-related revenue losses. The ARP also extends and adds funding for the Paycheck Protection Program, adding funding for EIDL grants, and provides support for socially and economically disadvantaged business owners to access relief. Can you move to the next slide? It also provides funding to enable financing for small businesses with a set aside for socially and economically disadvantaged businesses. The bill also adds $10 billion to boost domestic production of PPE and allocates $39 billion in block grants for childcare providers. Can you move to the next slide? So thank you again for the opportunity to provide this overview, and please stay tuned for future updates. In closing, I wanted to emphasize one message, which is to file your federal taxes. This is the best way to ensure that you receive the new stimulus funding and child benefits. And free assistance is available at the link shown here on the slide. We've also included a link to the Recovery Office's website where you can access publicly available reports. Thank you.
All right, thank you, Sarah. And for folks watching at home, if the slides were cut off, we will be posting this presentation online a little later today, so you can check in later this afternoon at phila.gov/recovery if you're interested in seeing those reporters who are on the call. If you need this PowerPoint sooner, please shoot us an email at press@phila.gov. Now let's turn things over to Finance Director Rob Dubo for an assessment of the impact on the city government's budget.
Thanks, Mike. Obviously, this is a huge benefit to us, and we are really appreciative of it. It does not, however, solve all of our budget problems. As Sarah mentioned, it's one-time money, and we have structural issues with our budget. before this package was enacted, we were facing a $450 million gap in our FY22 budget and structural problems that would have created challenges throughout our 5-year plan. Because we were expecting this package to come, we put off introduction of the mayor's budget till April 15th to give us time to understand what this package means. And so we're going through that process now. We're taking the $1.4 billion that estimated we'll receive, laying that on top of our plan to see what it means over the 5 years. We're also working with the outside econometric firm that we work with to look at what the other elements of the plan will mean for the local economy and what that might mean for our revenue projections. We also need to understand over time, and as Sarah pointed out, we don't know this yet, what the other components, the other funding streams in the package will mean for the city and what it'll mean for some of the costs that we assume that we'll have to bear through our 5-year plan. So overall, really positive, but we still have significant challenges as we put the plan and budget together. Thanks, Mike.
Thank you, Rob. Rob and Sarah will be sticking around for questions, but for now, let's go over to Dr. Farley for his update.
Thank you very much, Mike. So I'm back on coronavirus. Our case counts are level or rising, so we need to continue to be careful. Here are the numbers. Since this time yesterday, we've identified 312 new cases of the coronavirus in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed case count of 117,768 since the beginning of the epidemic, and an additional 61 probable cases diagnosed by rapid antigen tests. So for the past week, we averaged 262 cases per day. That's PCR and antigen combined. And so far, we expect that number to rise. And of those people tested, 5.0% were testing positive. And for comparison, the week before, we averaged 275 cases per day, and 3.9% of the tests were positive. So that's where we are in Philadelphia. And around us, our case counts are either level or they're rising in Delaware, New Jersey, New York, and New England. As far as deaths, we have 40 new deaths identified today, bringing us to a total of 3,217 since the beginning of the epidemic. Now, many of these deaths were identified from past weeks. If you actually look at the date of death, the number of deaths per week has been gradually declining. We were at about 40 to 50 per week in early February. We're down to about 25 to 30 per week in later February. Put that in context, the worst week of the epidemic, we were about 250 per week. And the best weeks back in late summer, we were less than 10 per week. Now let me move on to vaccination. Our supply of doses of vaccine continues to grow. Allocated to us last week for delivery this week were 22,000 first doses of the Pfizer vaccine. That's an increase of about 2,300 doses from the week before, and 15,600 first doses of the Moderna vaccine, and that's the same as the week before. In addition, there were first doses delivered to pharmacy chains directly by the federal government. I don't have an exact number for that, but it was approximately 6,000. So if you put that together, it's about 41,000 total first doses arriving in the city. That's up from about 20,000 just a few weeks ago. Now, in addition to that, though, there's vaccine that is being delivered directly to the team that is doing the vaccination at the Center City Vaccination Center. And about 6,000 people per day, that's about 42,000 doses per week that are going out through that channel. How are we doing as far as administration of vaccine overall? As of Monday evening, we reported vaccination on 368,000 people for their first doses and 142,000 people for their second doses. Now, launched yesterday, we have a new expanded dashboard on our website that gives you an update on our vaccination progress. It provides information on the doses administered and on the percent of the population that has now been vaccinated and on what vaccines are going out through different types of providers. One of the things you'll note on this is that so far, 68% of the vaccine that's been delivered by Philadelphia providers is to Philadelphia residents, and the rest to non-Philadelphia residents, including essential workers who work in Philadelphia but may live in the suburbs. Note also that the dashboard does not include Philadelphia residents who were vaccinated in the suburbs or in New Jersey. So the data we have is somewhat incomplete. Of that data, though, it does show that overall 16% of Philadelphia residents are known to be partially vaccinated. So again, that's an underestimate. And it breaks down that percentage by age and by race. But for example, 38% of people in Philadelphia at the age of 75 or older are now known to be vaccinated. And again, that's an underestimate. But even that is enough to make a difference, we think, potentially in the mortality from this infection citywide. Now, for the week ending on March 7th, there were a total of 93,000 doses that were administered by all the providers combined, first and second doses combined. And that was up from 54,000 the week before. Now, for last week, it ended on Sunday. So far, we know of 96,000 doses administered. That's not complete. We expect to be over 100,000 doses by the time we get all of our data in. As far as eligibility for vaccine, we are still in phase 1B. Means the people who are eligible are frontline essential workers. Now people over the age of 65, we added 65 last week, and people who have high-risk medical conditions. Now, looking off in the future, we can say that we will move to phase 1C sometime in April. I can't say when, but sometime in April, we will move to phase 1C, and we'll move to phase 2 on May 1st. Now, phase 2 means that all adults will be eligible for vaccination. Now, eligible for vaccination doesn't mean that receiving that vaccination on May 1st. It'll still take some time to vaccinate all those people who become eligible as of May 1st, but that is when we will open up eligibility to all adults. Back to what's happening today. So how is vaccine being made available? We now have 149 sites that are enrolled and receiving vaccine. That includes hospitals, a variety of clinics, and many pharmacies. In addition to all the sites that are run by these non-governmental entities, there are new community clinics that are being run by my department, the Department of Public Health, this week. Yesterday, we were at Simon Gratz High School at 1798 West Hunting Park in Nicetown. Tomorrow, we'll be at the Grand Yesha Ballroom at 2308 Snyder. And on Friday, we'll be at the EOM Athletic Association at 144 Moore in South Philadelphia. And the following week, there'll be 3 additional sites that will be open up run by city departments. Now, for next Tuesday, Thursday, and Saturday, we'll be doing second dose clinics at Martin Luther King Older Adult Center. That's this Tuesday, Thursday, and Saturday. We're doing second dose clinics at Martin Luther King Older Adult Center, Community Academy, and the University of Sciences. Now, just notice this, at some of our sites, the number of advance appointments have been low, been lower than the number of appointments available to us. And we don't want those vaccination opportunities to go unused. So we began last Saturday taking eligible walk-ins in the Martin Luther King Older Adult Center, and at Simon Gratz, we did take eligible walk-ins from the neighborhood in order to use up the vaccination opportunities that we had. At these clinics, we will continue to invite people from the database first, and to the extent that appointments are still available, we may allow people after that to come in without appointments. I should say, to the extent that appointments are still available. We know that for some of the clinics later this week, appointments are not available. So this will not necessarily be at every clinic. And I could use some help from the media here. In some cases, the message is getting out that all of our clinics are walk-up. And that's not true. And we don't want people showing up at our clinics assuming that they can get vaccinated if they don't have an appointment. We will allow walk-ups only if appointments are still available, and we'll get the message if they are. And I should note also that we're finishing a cycle of first dose clinics in the community, and then we'll be doing second doses for people who were vaccinated with those first doses 3 weeks earlier. Those second dose clinics are for people vaccinated there 3 weeks early only. We won't be taking walk-up appointments at those clinics. Now let me move on to the Center City Convention Center, Center City Vaccination Center at the Convention Center. This clinic is now close to hitting the target of 6,000 vaccinations per day. So it's been very successful in that regard. Overall, 79,000 people have been vaccinated since the convention center opened as through yesterday. People who have been invited are people who are in our database, vaccine interest, who are eligible under phase 1A or 1B criteria. That includes people 65 plus, people with high-risk medical conditions, and frontline essential workers. And for invitations, we've been inviting people citywide, but we've been oversampling people in the less vaccinated zip codes. Most people have been invited by email. Some have been invited by phone, and some have been in referral from community-based organizations. Now, we are still having problems underrepresenting African Americans and Hispanic Philadelphia residents in the people who are being vaccinated at that Center City clinic. Overall, of the people vaccinated through all the days so far, 13% have been African American and 11% Hispanic. Those percentages are much lower than the percentage of the population as a whole. Now, related to that, we're also underrepresenting people in the under-vaccinated zip codes. In fact, vaccination rates are almost 4 times higher in the highest vaccinated zip codes than in the lowest vaccinated zip codes. And we're also seeing at the same time that our invitations by email and by phone are not always leading to filled appointment slots, especially from the under-vaccinated zip codes. Now, we know that getting an appointment is a barrier for many people. It's complicated to schedule an appointment, and if your life has many challenges to it, you may not be able to make an appointment that you scheduled. So we want to make it easy as easy as possible for people to get vaccinated. So starting tomorrow, for the next 6 days at the convention center, that's March 17th through March 22nd, we will be doing a hybrid model. There'll be 3,000 scheduled appointments for people who are eligible under phase 1A or 1B criteria citywide who are in our vaccine interest database. And we think that there's some 92,000 people in that database, and everyone in that database will receive an invitation for at least 2 different days to schedule an appointment. In addition to that, there'll be 3,000 slots that we're going to call open access slots, where no appointment is needed, but not for everyone. These are strictly just for people who live in the 22 zip codes that are the most under-vaccinated, the lowest vaccinated 22 zip codes in the city, who are eligible based on age, medical conditions, or employment. Now, in addition to that, to make it easy for people to be vaccinated, we're going to be offering assistance in transportation from those under-vaccinated areas of the city, 2 days at a time. So there'll be 2 days where we're going to be providing assistance in transportation from West and Southwest Philadelphia, 2 days in North Philadelphia, and 2 days in areas of the Northeast and Lower Northeast that are the most under-vaccinated. The assistance is going to be through CCT service and free transit passes. And there are details on how this transportation will work in our press release. So what does this mean for people who want to be vaccinated? Message right now for everyone is still the same. The first thing to do is to go to our database, www.phila.gov/vaccineinterest, and put your name into our database. If you don't have internet, call 311 and they'll put you into our database. That will give you an opportunity to be directed to multiple vaccination opportunities, not just the convention center, but other opportunities as well. Or if there are people who live in the designated zip codes, Philadelphia residents only in those 22 lowest vaccinated zip codes, who are also eligible by being over 65 or having a high-risk medical condition, you don't need an appointment to get vaccinated at the convention center. Just to remind people what those high-risk medical conditions are, they include heart disease, diabetes, and obesity. And by that I mean a body mass index above 30. Now, there's a complete list of the high-risk medical conditions on our website and will be in our press release. People who want to try to go there without an appointment can come between 8 a.m. and 5 p.m. any day from Wednesday the 17th through Monday the 22nd. Okay, 8 a.m. to 5 p.m. any day, Wednesday the 17th through Monday the 22nd. People should bring evidence of their address to show that they do live in those targeted zip codes, like an ID or a bill or any piece of mail. Now, I should note that if you're from Philadelphia, but you're not from the 22 designated zip codes, and you come there without an appointment, you'll be assisted in getting into the database for a future appointment. You'll not be able to get vaccinated that day. And if you're not a resident of Philadelphia and you don't have an appointment, you'll be politely turned away. Now, for people who are from those 22 zip codes, who do come without an appointment, expect that you may have to wait. And you may have to wait outdoors, so come dressed for the cold and be prepared. If there are too many people that come, you may be asked to come back another day. So I know it's a complicated message, and I could use help from the media to be really clear on what to expect if people do try to come there without an appointment. Now moving on to our safer at home restrictions. Yesterday, Governor Wolf announced an easing of restrictions statewide in Pennsylvania, effective Sunday, April 4th. It will allow alcohol sales at restaurants, not in the context of meals. It'll remove the 11 p.m. curfew for restaurants, and expand the indoor dining capacity to 75% for restaurants that self-certified of certain safety precautions, although they're still encouraging outdoor dining. And gyms and theaters and malls and casinos will be allowed to go up to 75% capacity. Indoor events allowed to go up to 25% occupancy, and outdoor events up to 50% occupancy, as long as people maintain the 6-foot distance. So that leads a question about what we will allow here in Philadelphia, in the city of Philadelphia. We're still concerned about the high and possibly rising COVID rates. Our numbers are still quite high. And so we're going to review this information, what the governor is allowing, which just came out yesterday, and we'll determine what restrictions will be appropriate to continue here in Philadelphia We'll come back at a future press conference to detail that. Finally, just to remind people that overall, there's a lot of reason to be optimistic right now. But that optimism is really over the next few months. Today, the epidemic is still here and it's still deadly. So I want to remind people, don't let your guard down too early. To use the football analogy, don't fumble the ball on the 5-yard line. Wear a mask, keep your distance, and avoid being around others. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And for reporters on the call, as you heard Dr. Farley asking for help in getting the word out with details of the new walk-in, walk-up opportunities at the Center City Vaccination Center. That press release that we just issued is linked in the chat, so you could get that. That has the complete list of zip codes that are whose residents are eligible for this walk-up opportunity. And it also includes the information Lauren just put in the chat regarding the special event permitting. And with that, we're now going to move to Q&A from members of the press, in addition to Tumar hanging around, as well as Rob Dubo, Sarah DeWolf, and Dr. Jill Bowen. Because of very limited time today, unfortunately, we're only going to have time for one round of questions, limited to the various topics we have covered. Let's start off now with Mitch Blocker of NBC 10.
Thank you, Mike. Good afternoon. Dr. Farley, I have a couple of questions for you, sir. Event planners, venue operators in Philadelphia say that they can hold events safely if allowed some capacity. Can you expand on what your plans are, what your thoughts are for allowing indoor group gatherings in the city?
So indoor gatherings are allowed right now with restrictions. What worries us the most is indoor gatherings where people are not wearing masks. Particularly social gatherings like weddings and where people are maybe drinking and interacting very closely with each other for a prolonged time indoors. So we do prohibit these indoor gatherings, social gatherings where food and beverages are served. We do allow indoor gatherings where food and beverages are not served and where people are sitting in seating where they're separated from each other. We will look at what we can allow safely as if case rates continue to go down and vaccination rates continue to go up. I know that people who plan events often plan them well out into the future. We're looking at if we can provide some sort of sense of what the future might look like given our vaccination rates. I'm not ready to announce anything today, but I'm hopeful that in the future I can say, okay, as of this date, we think we can allow this sort of event to open up.
I know you've talked a lot over the past year about concerns about the population density in Philadelphia and viral spread in the city. As it relates to your mitigation efforts, but I'm curious about your thoughts about aligning Philadelphia fully with Pennsylvania in terms of reopenings. Do you think that will happen at some point?
Well, it would be convenient for us to simply align with Pennsylvania, but I am very concerned about the trend in the cases we're seeing right now. Case counts are not going down. If anything, they're going up. We're still having plenty of people die from this infection, and I'm worried that people are so eager to get back to normal that we may be opening up too quickly. So I'll simply say we're going to look at this, and if we feel that it's safe, it's okay for Philadelphia to be in alignment with Pennsylvania, we'll do that. That'll make it simpler for everyone. But if we feel that our residents need more protection, we may be more restrictive. Is
there a timeline for any updates, or is that just at your discretion?
I would hope that we'll have something, if not the end of this week, then by the press conference next week. The governor's changes go into effect April 4th. So we have a little bit of time for us to think about this.
And one question regarding the FEMA site. Is there any way that you'll be able to prevent, or is there a plan to prevent a mass rush of people who would be walking up? How would you deal with that?
So, first of all, we're trying to communicate clearly that it's only for certain zip codes and only for people who meet eligibility criteria. And then we're communicating to people that it may be crowded, and so they may have to wait, and they may be told to come back another day, they may be turned away. And then we'll have people monitoring this very closely on the scene. And if we find that we have many, many people come in the first few hours, we'll cut off the line and say, no more people today, and get a message out through a variety of channels, including text messages, that we're full for today. Please don't come on down after that point.
All right. Thank you, Mitch. Let's go to Annie McCormick of 6 ABC.
Hi, Dr. Farley. My question for you is also about the vaccination site. I just, again, want to make sure that I have clarity on it. In regards to the FEMA site, are you So at this point, it's only people within the certain zip codes that are allowed to walk up. I can just tell you this morning what I saw is we saw people walking up just hoping to get a vaccine that didn't have an appointment. There was also a woman who was from Montgomery County that does not work in Philadelphia. So she didn't actually meet the requirement. And it appeared that both of them actually got the vaccines. Is that something that you're okay with just because you want to get people inoculated? Or do you think now with this announcement you're making today that there's going to have to be some sort of stricter enforcement?
We do have people monitoring the door, and people can get in who have appointments if, and their appointments seem to be appropriate. I can say for the walk-up that we are going to be very careful about finding evidence that people do live in those zip codes and ask about medical eligibility criteria. So I can't explain each and every individual situation there, but we are trying very hard to, while we use up all the available appointments, we don't want to waste that resource to try to direct us to the appropriate people.
Okay, so message to the people in the 22 zip codes is you can arrive without an appointment. And while you get there, you may be told you have to come back another day, but now you have an appointment, or you have to wait in line and you will be able to get vaccinated today.
Correct. Well, first, this is only for people who meet our phase 1A or 1B eligibility criteria from those 22 zip codes. So we're going to look for that criteria based on age and medical conditions, look for zip codes. And if they're eligible under both, then they may be able to get in and get vaccinated that day. That would be great. If we're oversubscribed that day, they may be scheduled for another day or otherwise directed to come back on another day.
Do you have a quota that you want to meet in regards to the amount of people in those zip codes where then you'll be able to open it up to broader zip codes?
I would like to see much, greater fraction of the people that we're vaccinating be in these underrepresented minority groups and also being those under-vaccinated zip codes. So, and right now the demand is high citywide. So I don't think for this 6-day period, we're going to change that. I think we're going to stick with this policy unless we see problems with the policy in the next few days.
All right.
One last question for clarification.
So,
I have one last clarification, Mike, if you will let me. It has to do with the smaller city sites. Can you just explain that again, how this now applies to the smaller sites that you have opening?
For all the smaller sites, we are going to fill as many appointments as we can through invitations in the vaccine interest database. If it turns out that, as was the case in a couple of sites where there's open slots after we do all that, then we will put out a notice through community organizations and other organizations that there are open slots and people who meet eligibility criteria can come in. That may not happen. We may fill all of them. So for some of those clinics, they're all filled, and so that won't happen. But if it is available, we don't want to waste those slots. We'll put out an announcement often at the last minute that those appointments are available.
All right.
Thank you, Mike.
Sure. Let's go to David Melandra of Philly Sports Network.
My question's for Dr. Farley. So yesterday with Governor Wolf announcing these changes, have you given any thought about increased capacity for like sporting events for indoors and outdoors?
The governor's announcement didn't mention stadiums specifically or sporting events specifically. I want to see more details of the order and we'll look at that and see what if we think there's any implications for us here in Philadelphia. So it's just really too early for me to answer that question. Okay, and have you had a chance to see how the Flyers and the Sixers have had, since they've had their fans back in, how things have gone so far? I haven't had direct reports, but from what I've read about this, it looks like people have been fairly compliant with our standards, and that's a good thing. And final thing for me is right now, so the limits for Philadelphia are for 20% indoors and 15% indoors and 20% outdoors? That's correct. All right, thank you.
All right. Thank you there, David. We'll go to Johan Calhoun of Chalkbeat.
Thanks, Mike. I have 3 questions. First question is for Dr. Farley. How is the case count rising while access to the vaccine has increased?
Well, we vaccinated a lot of people, but it was still vaccinated a fairly small fraction of the people, overall 16%. So most people are still unvaccinated, and this virus can spread amongst all the other people who are unvaccinated. So that's why I want to really issue that warning. We haven't vaccinated enough people now to have an impact on the community-wide spread. So people still need to maintain their very careful restrictions.
Okay, second question is for Sarah DeWolf and possibly Tumar Alexander. The $1.3 billion that's going to the school district, has there been discussion how the funding will be broken down? Will any of it be dedicated for HVAC and ventilation systems, which actually has been the highest concern for teachers returning to schools?
I think, like us, the district is in the process of figuring out how they'll use the money and what restrictions there are. There are some more restrictions on that money than the money that's coming to the city, so they're still going through that process.
Johan, you good?
Last question. I would like to get reflection from Dr. Farley on 1 year since schools closed due to COVID-19. What did you learn the most throughout this time in accommodating educators? And what do you know now that you wish you known March of last year, especially in dealing with the vaccine?
Geez, those are pretty broad questions. I think I would just simply say that, as a pediatrician, and that I want our kids educated. I want them to be back in school as soon as possible. I think this has been very tough on kids to be out of school over the past year. And I do think that they can be back in school safely. And I'm very pleased that we now have vaccine offered to teachers. The CHOP vaccination process is moving along very well. And so I'm hopeful that we'll have more and more kids back in school.
Thank you.
Thank you, Johan. Let's go to Laura McChrystal of the Inquirer.
Hey, first I have a question for Rob Dubo. We heard last month that the predicted budget hole, could come with painful cuts in the next budget. Can you speak to whether the stimulus money will prevent the city from having to make cuts? Like, should we still expect to see a painful and slimmed down budget?
I think it would be much less painful than what we were looking at without this funding. As I said, we're still going through the process of seeing how this overlays with our budget and 5-year plan. So we're still early in that process, but we are in better shape than we were a week ago.
Okay. And then I have a couple questions for Dr. Farley. I'm wondering, is simply announcing these walk-up slots enough to really reach the targeted population and zip codes and improve racial equity, given that these people, might not have already to this point been signing up for whatever reason or getting appointments?
So there are a number of things that we're doing other than just announcing it here and making it available to make it easier for people, to make people aware of the opportunity, make it easier for them to come. So there's the press release. There are also robocalls going out from city council members to let people know about the opportunity. We have our Philly Counts team that is doing some phone banking to let people know about this. There's flyers being distributed. Information is going out through social media. Things are going out through text messaging. And then there are organizational partners that are doing things like distributing these transit passes. And so we hope through that in those targeted zip codes that more people hear about it and they'll take advantage of it. We don't know how many of them will. Going downtown is still a serious barrier, but we're doing everything we can to make it as easy as possible for them to come and get vaccinated.
Okay. And the gap between, according to the city's data, the gap between the percentage of white Philly residents who have been vaccinated as opposed to the percentage of the population of other races is actually widening, seemingly in large part due to the disparity at the convention center. What is your reaction to that, and what more can the city do?
Yeah, so we are very concerned about that. And so, this plan we announced today is one effort to try to deal with that. The other thing we did, we had a conversation with a very large number of community leaders last week to ask for their advice and their assistance in directing people to vaccination opportunities and advice at what else we ought to be doing. And I'd say the message that came out of that the most was to make vaccination more available closer to people's homes. And so we are doing what we can to do that. I don't have anything other than what we're talking about today to announce on that, but that's the other approach.
Thanks.
Thank you, Laura. Let's go now to David Merrill of Philadelphia Magazine.
Thanks. A couple questions for Dr. Farley. The first is about the I'm curious if when you say you're oversampling lower zip codes to the FEMA clinic, but I think you said there was still a 4-to-1 gap in people actually receiving the shots from higher vax to lower vaccinated zip codes. I'm just curious, can you define a little bit more what you mean by oversampling in terms of like what the proportion of invites given out to the lower zip codes is compared to the higher zip codes?
The ratios changes over time, but approximately people in the lowest zip codes were maybe twice as likely to be sampled on a per capita basis as people in the middle vaccination zip codes.
Got it. And it's per capita. Okay, that was my other question.
Yes.
On the community health department clinics that you're running, I'm curious, for those that have unclaimed vaccine slots, is that a problem of not enough people actually being in the interest form for those zip codes to actually invite, or just not enough appointments being made from those who are receiving invites?
There are people to invite, but we send out invitations and they don't lead to appointments. We don't know if they didn't get the message, or if they've already been vaccinated, or if they just chose not to be vaccinated. But we know if we invite and they don't come, we want to make opportunity for that. And we did find that the 2 times we tried this, that there were people in those immediate neighborhoods that heard about this and took advantage of the opportunity.
Do you have any sense of what percentage of people invited from those zip codes are making appointments?
It's certainly less than 25% of those invited. Again, not necessarily because they chose not to. They may have already been vaccinated. We don't have all of their names matched. Maybe they didn't get the message, but it's a fairly low percentage of those invited actually end up leading to appointments.
And just my final question, I'm just wondering if you could give any comment on where sort of your thought process as far as where the health department is at in terms of the strategy of using the vaccine interest form as opposed to things like walk-up clinics. I'm asking in particular just because I'm curious if you're thinking if you think the vaccine interest form has worked well from an equity standpoint, just given what you mentioned about the lack of appointments at the health department clinics and then the sort of disparity in FEMA.
Yeah, I think that the vaccine interest form process has done a lot of good. It helps direct people to appointments. There's been a huge demand relative to supply, but it's not perfect. There are some people that getting their name in their database and then scheduling an appointment is a complicated process that they may not be able to get through. And so over the longer term, I would like to have more walk-in availability. When the demand greatly exceeds supply, there's a risk of having walk-up availability that you'll have a huge crowd and that doesn't serve them well. And so we're right now in, I guess, something of a transitional process where we have some scheduled and some walk-up. And as we get closer to meeting demand, I think we'll probably be having more walk-up.
Great,
thank you, David. We're going to go to Max Marin of Billy Penn.
Hi, questions for Dr. Farley. Just jumping on the oversampling question again. I mean, how long ago did you realize that the oversampling was not working based off of the city data, and why did you decide to wait until with just like 6 days left at the FEMA site to get first doses in? And do you think that this is enough to close the gap that you're seeking to close in just less than a week?
We've had the scheduling of appointments has been limited, as you probably know if you've been in these previous press conferences, by the fact that early on we had the links could be shared. And so we sent invitations and other people who were not invited were filling in appointments. Once we solved that problem, then it became clear that there were open appointments after the people who we were inviting had been invited. And so then that's when we came up with this plan. The FEMA site is not finished. It's only been there about 2 weeks. This now a 3rd week, then we'll go to second doses, but then there'll be more time after that. And then we have opportunities at our community sites. And we're going to be at this as long as it's necessary. I know it's not necessarily a race for people to be vaccinated. We simply want to get ultimately as many people vaccinated as possible. And so it's going to, we're going to continue to work at this.
Understood. Quickly, you mentioned the link sharing issue as one of the holdups. Has that been fixed?
There's a workaround, I should say. It's not perfect. The software has its limitations, but we've managed to work with the workaround.
Okay. The city recently sent out new guidance for providers about not pulling extra doses from vaccine vials. We've heard from some providers who are upset about this, feel like they're wasting some vaccine. Do you have any clarification on why this change was made?
This directive came down from the Center for Disease Control. I have to get back to you with more detail. But I think that there's a problem that there are 6 doses you can get out of a vial. Some providers were able to try to get a 7th. If they do, then ultimately that leads to shortages of syringes or other problems. And so, whereas it may seem to help for that one patient, in the long run, it does hurt you.
Okay, last question for you. If you can bear with me. In the early stages of the vaccine rollout, there was a lot of concern about vaccine hesitancy in communities of color, and you had mentioned this recently as well. Is this still an issue that the health department is focused on, and how are you determining that?
We are concerned that that is still an issue, and so we are also, while we're working on improving access, we're working on communicating with opinion leaders about how to communicate about the safety of the vaccine. And we are planning a media campaign to really try to get the message out to a much broader level about the safety and the importance of the vaccine.
All right, thank you, Max. Let's go to Mike Donofrio of the Philadelphia Tribune. Mike.
Here. Let's see here. So, how does this federal funding plan, the stimulus, differ from the last federal assistance that Philadelphia received back, in the fallout from the 2008 crisis? Is this better, worse, in your opinion? I guess this is for Rob.
Yeah, this is different. We didn't get this type of huge influx of federal money for our operating budget back then. So that's a very big difference between now and back then.
Any other opinions about it? Better? Well, do you think it'll help the city recover faster?
It definitely will help the city recover faster. If we had not received this money and we had to figure out how to balance a $450 million gap after having closed a $750 million gap, we would have had to make really painful decisions that would not, that would have hurt the city and the region's recovery. So in that way, this was desperately needed. And as I said before, we're still trying to figure out what it means in terms of what we have to do with the budget and 5-year plan, but this was desperately needed funding.
All right, can you kind of put the stimulus program in perspective too, right? So not only is the city government going to get funding, the school district's going to get funding, but right, all these other households are now going to be eligible for this child tax credit, and all these other households are now going to be eligible for this $1,400 payment. How will that money kind of help the city recover in the long term? And more importantly, how will that new money help reduce poverty in the city?
Yeah, so it will give people money to spend, which will have, will help the economy recover more quickly than it would have. So that's really good for everyone in the city. So, I mean, it's got, and you're right, it's got a lot of different elements. It's got the $1,400 checks. It's got the extension of unemployment. It's got rental assistance. It's got homeless assistance, money to the school district, infrastructure money. So really important things that will really help the economy. I don't know, do you want to add anything, Sarah?
I think the only other 2 things I would add, I mean, you mentioned rental assistance. I think it will help keep people in their homes. And I think there's also expanded healthcare access, which seems like it will also be impactful.
Sorry, not to burn another question, but any specific thoughts about how that money could affect poverty specifically in Philadelphia? I mean, in many ways, in my perspective, it looks like a wish list of things to help address poverty throughout the city in a variety of ways. But, from the administration standpoint, any thoughts again on specifically poverty and poverty reduction and what it could do?
So I think by having things like rental assistance, things like expanding SNAP, it's giving people more resources, which then will have a really positive impact on reducing poverty.
All right. I guess.
Thank you, Mike. We are pretty much out of time, but we have 4 people left with their hands raised. We're going to try to get to you, but please keep your questions as tight as possible. Let's go quickly to Jack Tomzik of Metro.
Yes, this first question's for Dr. Farley. I've been hearing of people who get invited to the convention center site and they log on to try to set up their appointment and they see there's no appointment and they got it for a specific day. What's happening there and what should those people do?
It is possible that we estimate how many of those folks are going to make an appointment. It's possible that we may have overestimates. everybody who's in the database who's eligible over the next 6 days will be invited for at least 2 different days. So if they can't make one day, they may have an opportunity another day. And if they don't make either of those days, then other opportunities will be sent to them. As long as they're in that database, we will continue to invite them for vaccination opportunities.
Okay, and this is for Rob Dubo. Do you have an estimate? You know, you talked about the $450 million budget deficit. I mean, does this cut this in half? Does it cut it by a third? How much impact does it make on the budget deficit?
Yeah, so we're going through that process right now to understand what this money means for not just FY22, but for our 5-year plan. So the money is, the way the act is spread out, we get the money in 2 tranches, one in a couple of months and then one in a year. And we have until the end of calendar 24 to spend it. So it's early in our process, so I can't give you kind of the exact ratio you're talking about, but we are working through that process. And by the time we submit the budget in April 15th, we'll have that all detailed.
Thanks. One more quick question.
Jack, you there? We lost you. All right, Jack, we'll see if we can go back to you, but let's go to Martin Pratt of Philly YBN.
Thank you. Dr. Farley, can you explain a little bit about the process to find out if you're a part of the 22 zip codes, and also where do people go to get their appointment?
The 22 zip codes, I won't read them all off, but they're in the press release that's going out and they're in the chat.
Okay.
And they're in Southwest Philly, West Philly, North Philly, and a little farther northeast. And if they're in that 22 zip codes, well, and anybody who wants an appointment should get their name in the database, and they'll be invited to schedule an appointment. But if for whatever reason they're not in the database, they don't get an appointment, if they're in the 22 zip codes and they are eligible based on their age or medical conditions, they can try just coming on down there to get come in as a walk-in, essentially. And if they do that, they may have to wait. Or if we're oversubscribed, they may be told to come back another day. But we're hoping that'll be an avenue for people who, for whatever reason, couldn't schedule appointments to still get vaccinated.
Excellent, thank you. And lastly, this has been a trying 12 months, and you have definitely shepherded the city through a lot of stuff. Any thoughts on report card for the city and Department of Health? Like, I know that we were considered in the top 10 cities in the country for wearing a mask. How would you rate, Philly going through this trying, unprecedented pandemic?
I'm so involved in dealing with the issues moment to moment that I haven't had the chance to step back and sort of assess how well we've done. It's not me, but the entire city. I can say that we've got a lot of great professionals that are working really hard. I've been working nonstop for a year on this, and we've tried the best we can. And I can also say that after some very tough times for everyone in the city, that I really have optimism now that we're going to be pulling our way out of this in the next few weeks and months.
Thank you very much.
Thank you, Martin. Let's go quickly to Brian Mendoza of Telemundo. Brian?
Hello there. If Armando can help me translate these questions. Armando, se informó que la ciudad levantará la prohibición de los eventos al aire libre y que comenzará a aceptar solicitudes desde el día de hoy. ¿Se puede dar más detalles sobre esto y hablar tal vez sobre el proceso de la revisión de las solicitudes y las restricciones, si las habrá, que vendrán con este levantamiento de la prohibición? Como por ejemplo, si se aprueba, se tendría que usar mascarillas al mismo tiempo, y cuándo esto empezará.
Muy bien, Brian, muchas gracias. This question it was reported yesterday that the city will be lifting the ban on outdoor events and will start taking applications today. Can you elaborate and talk about the application review process and any restrictions that might come with it when the lifting of the ban proceeds? If they're going to be wearing masks, or there's going to be limits on attendance, for instance?
So I think I need help from Tumar Alexander on that.
Yeah, so we are opening up the application process today. along with that process, we'll have a requirement for folks to sort of submit a COVID safety plan to us, and that plan must be approved before we issue the permit. So we'll be ensuring that there's restrictions and processes in place to have folks put on safe events. Although we're opening the process today, it doesn't necessarily mean we'll be issuing permits starting tomorrow. We'll have a process to where our internal staff are reviewing those permits, ensuring that folks do have all the requirements in place and that we're communicating back and forth with them. There is some loss of capacity as it relates to some city services and some city material that event organizers need to understand and work with us and work with privately to secure in order to make their events a success.
Thank you. Brian, efectivamente, el proceso para solicitar permisos para tener los eventos al aire libre se abre el día de hoy. Sin embargo, esto es parte de un proceso que requiere que aquellos interesados presenten un plan de seguridad ante el COVID que tiene que ser aprobado antes de que se otorguen los permisos. Va a haber obviamente restricciones para ello porque es un proceso y el que se abra el día de hoy la toma de solicitudes no significa que se entreguen esos permisos el día de hoy. Nuestro plantel tiene que repasar cuáles son estas restricciones, cuáles son los requisitos y tiene que haber una conversación con los solicitantes para ver que ellos puedan cumplir con ello. Obviamente va a haber una pérdida de la capacidad total que se va a permitir y otras restricciones para asegurarnos de que reabran con éxito y que sea un éxito.
Entonces se tiene ese límite de una fecha tal vez para cuándo van a empezar los eventos.
Is there then a date associated with a time when events will be allowed, will start back up?
It'll vary we'll be reviewing applications between 30 and 90 days. So certainly can't say in particular, not knowing what events or what applications we have in the process. So I can't put a particular date or activity or just be able to announce that just yet until we see the applications that come in.
Estimamos, Brian, de que el proceso de revisión de estas solicitudes nos tome de 30 a 90 días y ese es un estimado. Por lo tanto, al no saber cuáles son los eventos ni los solicitantes que están presentando estos permisos o solicitudes de permisos, no puedo adelantar una fecha. Lo vamos a ver hacia el futuro.
Listo. La segunda pregunta. ¿Cuáles son los criterios para que los códigos postales se incluyan en estas ubicaciones de los sitios de vacunación de la ciudad? Por ejemplo, el código postal como el 19148 y 19147 tienen una comunidad de inmigrantes significativa, pero no están incluidos en esta lista donde las personas pueden obtener la vacuna.
This is probably a question better suited for Dr. Farley. What is the criteria for the inclusion of zip codes in the city vaccination site locations? There are zip codes such as 19148 and 19147 that have a significant immigrant community and they're not included.
We just looked at, based entirely on the current vaccination rate per capita. So these are the 22 zip codes that have the lowest vaccination rate per capita.
Esta determinación se hace en base a la tasa de vacunación per cápita en cada uno de los 22 códigos postales, Brian, y eso se hace en base a los que tienen los índices menores de vacunación.
All right, thank you, Brian. We are going to move finally to Pat Loeb of KYW.
Hi, Dr. Farley, do you have any theories on why cases are going up again?
You know, it's really unclear to me. It could be that people are just becoming complacent, letting down their guard. But what's odd is that the area of the country that is where these case rates are the highest right now is in the areas of the country where mask use is pretty high. New York, New Jersey, Connecticut, Massachusetts, these are not anti-mask places. And the areas of the country where people are putting away masks still have lower rates. And so it's possible that there's some variant of the virus in this region, or the epidemic always follows patterns that we can't fully explain. It's just now this is the time period it's here, and later on it'll be hot somewhere else. I think it's too early, but the fact remains that the case counts are high. If anything, that they're rising, and it's still deadly, and so we still need to be very careful about it.
Given that the case counts are rising, is this a good time to start permitting special events again?
I think the special events will be permitted with caution and off into the future when we hope vaccination rates are higher.
Okay, thank you.
All right, thank you, Pat. We have one more. Jack Tomzik had a question, but had some internet problems. Dr. Farley, let me just read his question. You had mentioned people coming to the walk-in, walk-up site at the convention center should bring proof of residency, but he asks, do they also need to bring proof of age or medical condition? In other words, proof that they would be in 1A or 1B.
Proof of age would be good. They do not need to bring proof of medical condition. We'll take their word for that.
Very good. Thank you, Jack, and thank you, everybody. That concludes the Q&A portion of our press conference, and now we are going to move to Armando for the Spanish language translations of our opening remarks. Armando?
Thank you. Mike, one moment. We have a lengthy presentation today, so we're going to start in just a moment. And now we're going to start with las palabras del director general Tumar Alexander. Hoy hace un año, el COVID-19 llegó a Filadelfia y nuestras vidas cambiaron para siempre. Hoy hace un año tomamos la difícil pero necesaria decisión de suspender toda actividad comercial no esencial y los servicios gubernamentales para ayudar a frenar la propagación del COVID-19, y aproximadamente una semana después, el 25 de marzo, perdimos al primer residente de Filadelfia a causa del COVID. Mientras pausamos para lamentar la pérdida de casi 3.200 habitantes de Filadelfia que han perecido a causa de este virus, también debemos reconocer a todos aquellos que han sacrificado de otras maneras desde que la pandemia se desató. El personal médico de toda la ciudad que se esforzó por salvar vidas a pesar de los riesgos para su propia salud, los socorristas y otros empleados de la seguridad pública que siguieron protegiendo a los residentes en medio de gran incertidumbre. Otros trabajadores esenciales, como nuestros farmacéuticos, empleados de supermercados y repartidores, que mantuvieron a nuestra ciudad en funcionamiento en circunstancias extremadamente difíciles. También a los padres y cuidadores que priorizaron el apoyar a sus hijos con su aprendizaje en línea, incluso si eso significaba la pérdida de sus trabajos. Cada uno de nosotros ha sacrificado algo este último año. Nos debemos a nosotros y a los demás el reflexionar sobre cómo todo esto ha marcado este sombrío aniversario. Se han organizado varios eventos para reflexionar a lo largo del día de hoy y animamos a los residentes a que también lo hagan de su propia manera. Esta mañana el alcalde Kenny compartió sus reflexiones en un video mensaje en las redes sociales. Él les pidió a los lugares de culto que al mediodía tañeran las campañas o desplegaran otros símbolos de recuerdo de este aniversario. Esta tarde, la Oficina de Asuntos Religiosos e Interconfesionales organizará un evento virtual que ofrece la oportunidad de considerar tanto lo que hemos perdido como todo aquello que hemos aprendido. Y por último, a partir de las 7 de la noche, los edificios de la ciudad iluminarán de azul para honrar a las vidas perdidas por el COVID-19 y a nuestros trabajadores de primera línea. Animo a todos a que se dediquen un momento para reflexionar sobre los retos del año pasado, así como sobre nuestros momentos de esperanza y alegría que hemos compartido. Y cuando lo hagan, no duden en compartirlos con todos nosotros en línea utilizando el hashtag #BillyReflects. Un año después, aún no hemos disipado todas las dudas, pero afortunadamente estamos haciendo avance en varios frentes. En nombre del alcalde Kenny, quiero darle las gracias a todos los habitantes de Filadelfia que han puesto de su parte para limitar la propagación del virus y para mantenerse a salvo. Y por supuesto, durante estos últimos 12 meses, la atención se ha centrado en las pruebas, en el distanciamiento social y ahora en la administración de la vacuna. Pese a que dedicamos tanta atención a la protección de nuestros cuerpos, el Departamento de Servicios de Salud Mental y Discapacidad Intelectual de la ciudad también ha estado trabajando en una campaña para recordar la importancia de la atención a la salud mental. La doctora Jill Bowen, comisionada del Departamento de Salud Mental y Servicios de Discapacidad Intelectual, nos habla próximamente de la nueva campaña Boost Your Mood o Mejora tu estado de ánimo. Y estas son las palabras de la doctora Jill Bowen, comisionada del Departamento de Servicios de Salud Mental y Discapacidad Intelectual. Esta semana, el Departamento de Servicios de Salud Mental y Discapacidad Intelectual está lanzando Boost Your Mood o Mejora tu estado de ánimo, una nueva campaña de concientización pública que ofrece un apoyo para la salud mental mientras las personas se vacunan contra el COVID-19 para proteger sus cuerpos. La campaña les lleva información directamente a las personas en los lugares de vacunación contra el COVID-19 en toda la ciudad sobre cómo acceder fácilmente a los servicios y la atención de salud mental. En los lugares de vacunación, los habitantes de Filadelfia tendrán acceso a consejos de bienestar y a los números de teléfono de salud mental de emergencia y de no emergencia. Aquellos que busquen apoyo adicional para niños, adultos, familias y comunidades podrán utilizar los códigos QR para acceder fácilmente a herramientas en línea, incluyendo blogs de expertos, un autoexamen de salud mental gratuito y un amplio paquete de información descargable, y más aún en dbhids.org/boost. Esto es dbhids.org/boost. El Departamento de Salud y Servicios Sociales se compromete a reducir el estigma a menudo asociado con la búsqueda de servicios de salud mental y el abuso de sustancias. A medida de que crece la esperanza, con los mayores esfuerzos para distribuir la vacuna contra el COVID-19, reconocemos el impacto en el bienestar mental y la importancia de crear conciencia sobre la necesidad de cuidarse y elevar nuestro estado de ánimo. Aunque esta campaña será más visible en los centros de vacunación, el mensaje general es que no hay vergüenza en no sentirse bien en estos tiempos difíciles y que hay ayuda disponible para responder en múltiples niveles al impacto del trauma del COVID-19. Este último año, el estrés y la ansiedad tan abrumadores no se originan solo por el aislamiento a consecuencia del coronavirus. También se deben al crecimiento de la pobreza, al desaparecer los empleos y tras el cierre de los negocios. Incluye también el estrés de los padres que convierten sus casas en escuelas mientras intentan llegar a fin de mes y además los meses de disturbios civiles en la ciudad, junto con la plaga del aumento de la violencia por armas de fuego, la crisis de sobredosis en curso y mucho más. En el año transcurrido desde que COVID llegó a Filadelfia, todos hemos experimentado un trauma prolongado de estrés, ansiedad, aislamiento y pérdida. Es aceptable no sentirse bien. Usted no se encuentra solo. Estamos aquí para ayudar. Por favor, visite dbhids.org/boost para obtener más información. Y estas son las palabras de Sarah DeWolf, funcionaria de recuperación y directora adjunta financiera de la ciudad. Hoy se presentará una descripción general del plan de rescate estadounidense, qué es lo que es y qué significa para Filadelfia. La información que vamos a presentar hoy es preliminar, queda sujeta a cambios. Nosotros continuaremos informándole al público a medida que nos enteremos más sobre lo que significa el plan para Filadelfia en los próximos meses. El plan de rescate estadounidense es un proyecto de ley de estímulo de 1.900 millones que aprobó el Congreso y promulgó el presidente Biden el pasado jueves 11 de marzo del 2021. Es importante destacar que el proyecto de ley incluye varias formas de ayuda para el pueblo estadounidense, incluyendo ayuda directa para individuos y familias, así como ayuda para empresas y organizaciones sin fines de lucro que se han visto afectadas negativamente por la pandemia. La ciudad de Filadelfia ha estado monitoreando el avance del proyecto de ley desde su propuesta inicial a mediados de enero. Nuestros esfuerzos se han centrado en garantizar que los gobiernos locales como Filadelfia reciban fondos directos y flexibles para reemplazar los ingresos que se perdieron como resultado de la pandemia. Nos complace ver que la versión final del proyecto de ley conserva estos fondos. Las categorías más importantes de gasto son para el alivio directo a las personas, en forma de pagos directos, mejor conocidos como cheques de estímulo, para los gobiernos estatales, locales y tribales. Hay otras categorías importantes de gasto para que son la extensión para las ayudas por el desempleo y para la reapertura segura de las escuelas. El proyecto de ley proporcionará $350,000 millones en fondos directos del Tesoro de los Estados Unidos para los gobiernos estatales y locales. El financiamiento de los gobiernos locales se asignará en dos partes. El 50% dentro de los 60 días posteriores a la promulgación de la ley y el 50% 12 meses después. Nuestro estimado actual de lo que recibirá Filadelfia como condado es de $1.400 millones. Si bien esta es una cantidad significativa de financiamiento, es un financiamiento único y tiene usos restringidos, como los costos relacionados con la respuesta a la pandemia y sus consecuencias económicas, y para reemplazar las pérdidas de ingresos en relación con las proyecciones vigentes previas a la pandemia. Otras áreas de financiamiento que esperamos sean para actividades relacionadas con los esfuerzos de vacunación. No hay estimados para Filadelfia en ese aspecto en este momento. También para el reembolso de costos elegibles a través de FEMA, el financiamiento para bomberos y otros socorristas, la asistencia de emergencia para el alquiler, vivienda y servicios de apoyo para las poblaciones sin hogar. El estimado actual es de $42,6 millones para Filadelfia. También el reembolso de banda ancha y el apoyo de socorro y la nómina de los aeropuertos. Para reiterar, estas son fuentes de financiamiento que esperamos recibir directamente. Es posible que existan oportunidades de financiamiento adicionales disponibles a través de la Mancomunidad de Pensilvania, pero no tendremos una idea de cuáles son esas oportunidades durante algún tiempo. Además de la ciudad, hay otras instituciones en Filadelfia que pueden esperar recibir fondos directamente del gobierno federal. El proyecto de ley proporciona fondos para la reapertura segura de las escuelas de kindergarten al 12º grado. Actualmente estamos estimando que el distrito recibirá $1.300 millones para esto, así como para el reembolso de gastos para proporcionar servicio de Internet. El plan también les proporcionará $40.000 millones a nivel nacional a las instituciones de educación superior que permitirán compensar su pérdida de ingresos. Asimismo, les proporciona fondos a las agencias para cubrir sus gastos operativos al mantener sus servicios debido a la pérdida de ingresos que sufrieron a causa de la pandemia. Por último, el proyecto de ley proporcionará $5.000 millones en fondos para vales de vivienda que se destinarán a las agencias de vivienda pública como la Autoridad de Vivienda de Filadelfia y para el asesoramiento de viviendas. Cambiando de tema, ahora vamos a hablar de la asistencia que se espera para los individuos y sus familias. El proyecto de ley prevé el envío de cheques de estímulo de hasta $1.400 para personas que ganen hasta $75,000 al año y para contribuyentes que ganen hasta $150,000 conjuntamente. Estimamos que más de 1 millón de habitantes de Filadelfia serán elegibles para este alivio, lo que representa un porcentaje muy grande de nuestra población. Este plan también extiende las ayudas por desempleo hasta el 6 de septiembre del 2021, lo cual representa una extensión crítica más allá de la fecha límite previa de mediados de marzo. El proyecto de ley también proporciona una disposición importante para las familias con niños, la expansión del crédito tributario por hijos al aumentar la cantidad y eliminar el requisito de que las familias deben tener ganancias tributables de al menos $2.500, haciendo que el crédito sea totalmente reembolsable para el año fiscal 2021 y proporcionando pagos por adelantado a partir de julio. Estimamos que alrededor de 300,000 niños en Filadelfia serán elegibles. En este caso, eso es más del 90% de nuestros niños en la ciudad. Otros beneficios incluyen la expansión del EITC, es decir, el crédito por ingresos del trabajo, el acceso ampliado a los beneficios y el acceso a los alimentos, lo que hace que los subsidios de la Ley de Cuidado de Salud de Bajo Precio o Obamacare y Cobra sean más asequibles. Y como se mencionó anteriormente, también le brindan asistencia para el alquiler y para los propietarios de viviendas. Las empresas también serán elegibles para recibir ayuda directa a través de este plan de rescate. El proyecto de ley crea un nuevo fondo de revitalización de restaurantes, que se reserva $286,000 millones en subvenciones para restaurantes que experimentaron y experimentan pérdida de ingresos relacionados con la pandemia. También extiende y agrega fondos al programa de protección de cheques de pago, agrega fondos para las subvenciones de EIDL, que son los préstamos por daños económicos debido a los desastres, y le brinda apoyo a los propietarios de empresas en desventaja social y económica para que puedan acceder a esta ayuda. Asimismo, proporciona financiamiento para permitir la recuperación de las pequeñas empresas, enfocándose en las empresas desfavorecidas social y económicamente. Finalmente, el proyecto de ley también le agrega $10,000 millones para impulsar la producción nacional de artículos de protección personal y asigna $39,000 millones en subvenciones en bloque para los proveedores de cuidado infantil. Esperamos que estos proyectos tengan éxito y nos traigan estos fondos muy necesitados en Filadelfia. Y esta es la actualización en materia de salud para el 16 de marzo del 2021. Estas son las palabras del comisionado Farley. Los conteos de casos han estado nivelados o subiendo en las últimas 2 semanas y esto nos indica que debemos seguir teniendo cuidado. Y comenzamos con las cifras del día de hoy. Hoy confirmamos 312 nuevos casos por pruebas PCR con un total de 117,768 casos confirmados. Reportamos también 61 casos probables por la prueba rápida de antígenos. La semana pasada, el promedio de casos diarios fue de 262 casos por día. basados tanto en la prueba PCR como la de antígenos. Y hasta el momento, pero esperamos que sean más con un 5% de pruebas positivas. La semana anterior, del 21 al 27 de febrero, el promedio había sido de 275 casos por día, con un 3,9% de pruebas positivas. El conteo de casos está estable o subiendo también en Nueva York, en Nueva Jersey, en Delaware y en Nueva Inglaterra. Con relación a las muertes, hoy identificamos 40 fallecimientos. El total acumulado es de 3.217 muertes por el COVID-19. Muchos de estos se acumularon semanas atrás y los fallecimientos están declinando lentamente en general. A principios de febrero hubo de 40 a 50 muertes por semana, por lo que vemos que los números disminuyeron a finales de mes porque tuvimos de 25 a 30 muertes por semana acabando el mes. En cuanto a la vacunación, en relación al suministro de vacunas, reportamos que los suministros, felizmente, siguen creciendo. Los números de dosis asignadas para la entrega la semana pasada y que se entregarán esta semana son 22.000 de la primera dosis de la vacuna de Pfizer. Esto es un aumento de 2.300 dosis de la entrega de la semana pasada y 15.600 de la vacuna de Moderna. 6.000 primeras dosis a las cadenas de farmacias de parte del gobierno federal, lo cual representa aproximadamente 41.000 vacunas de la primera dosis. Todo esto, además de las vacunas en el centro de vacunación de Center City, con 42.000 dosis por semana. En cuanto a la administración de la vacuna, hasta el día lunes en la noche se reportó que 368.000 personas han recibido la primera dosis y 142.000 la segunda dosis. También ayer reportamos que el Departamento de Salud ha actualizado el panel de visualización de datos en el sitio web de COVID de la ciudad para mostrar información más detallada. El panel actualizado ahora incluye información de las dosis administradas basadas en el porcentaje de la población general que ha sido vacunada y un resumen de las administraciones de vacuna según el tipo de proveedor. El 68% de las vacunas se han administrado ahora a residentes de Filadelfia. El panel no incluye a los residentes que han sido vacunados en los suburbios o en Nueva Jersey. Podemos ver que por lo menos el 16% de los residentes de Filadelfia ya están parcialmente vacunados. También se puede ver las tasas de vacunación por grupos de edad y de raza. Por ejemplo, sabemos que al menos el 38% de los mayores de 75 años de edad ya han sido vacunados, una cifra suficiente para marcar una diferencia. La semana que terminó el 7 de marzo culminó con 93.000 dosis administradas, incluyendo primera y segunda dosis. Esto es un aumento de 54.000 dosis comparada con la semana 1. Tenemos datos de que culminó el 14 de marzo, pero hasta el momento reportamos 96.000 dosis administradas. En cuanto a quiénes son los elegibles, seguimos aún en la fase 1B, que durará varias semanas. Esta fase incluye a los trabajadores esenciales de primera línea, las mayores de 5 años de edad y las personas con condiciones médicas de alto riesgo. Esperamos movernos a la fase 1C en algún momento en abril y a la fase de mayo. Ahora pasamos a cómo estamos haciendo la vacuna disponible hoy en día. En estos momentos hay varios centros proveedores inscritos, incluyendo hospitales, clínicas y farmacias. El Departamento de Salud añadió 3 nuevas clínicas masivas esta semana. Estas se llevarán a cabo ayer, el día 15 de marzo, fue en la escuela secundaria Simon Gratz, en el 1798 West Hunting Park, en el barrio de Knightstown, Tioga. Mañana, el día miércoles 17 de marzo, en el Grand Yesha Ballroom, en el 2308, en la calle Snyder, en el suroeste de Filadelfia. Y el viernes 19 de marzo, en la Asociación Atlética EOM, en el 144 de la calle Moore, al sureste de Filadelfia. La próxima semana tendremos 3 clínicas más. El próximo martes, jueves y sábado tendremos clínicas de segunda dosis en el Centro de Adultos Mayores Martin Luther King, en el Community Academy de Philadelphia Charter School y en la Universidad de las Ciencias. En algunos sitios, el número de citas previas es escaso, por lo que el sábado pasado empezamos a aceptar solicitudes sin cita previa. Esto ha funcionado bien en el Centro de Adultos Mayores Martin Luther y en la Escuela Secundaria Simon Gratz, siempre y cuando haya vacunas disponibles. En el Centro de Vacunaciones de Center City, en el Centro de Convenciones. El centro de 6.000 personas al día y hasta el momento se han administrado 73.000 dosis desde su inicio. Recordamos que el Centro de Vacunación de Center City se administra a vacunas de aquellas personas que han completado el formulario de interés en la vacuna y que son elegibles. En estos momentos, esas personas son los trabajadores esenciales de primera línea, las personas mayores de 65 años de edad las personas con condiciones médicas de alto riesgo. Además, se sigue haciendo el esfuerzo para seleccionar a las personas de los códigos postales menos vacunados. La mayoría de las personas son invitadas por correo electrónico, por teléfono o por organizaciones comunitarias. Aún hay problemas con los bajos números de representación de afroamericanos y latinos residentes en Filadelfia. Hasta ahora, solo el 13% de las dosis administradas en el centro de vacunación de Center City son para afroamericanos, solo el 11% son hispanos. En relación con esto, continúan los bajos números de representación de las personas en los códigos postales poco vacunados. También vemos que las tasas de vacunación son 4 veces más altas en los códigos postales con mayor nivel de vacunación que en los códigos postales con menores índices de vacunación. Al mismo tiempo, las invitaciones por correo electrónico y por teléfono no siempre conducen a que se llenen las plazas, especialmente en los códigos postales con menos vacunas. Sabemos que el requisito para solicitar una cita es un obstáculo para muchas personas y queremos que el vacunarse sea lo más fácil posible. Entonces, a partir de mañana, durante 6 días, del 17 al 22 de marzo, operaremos con un modelo híbrido. Es decir, tendremos 3,000 citas programadas para personas elegibles en la fase 1A y 1B en toda la ciudad. Aproximadamente 92,000 personas en la base de datos recibirán su invitación al menos 2 días antes para agendar su cita. Sin embargo, tendremos también 3,000 espacios reservados para acceso abierto, es decir, para aquellos que no hagan una cita y no la necesitan. Esto se aplica para personas elegibles, bien sea por su edad, por su situación médica o su empleo, en los 22 códigos postales con los índices de vacunación más bajos. Además, les ofreceremos transporte desde áreas de la ciudad cuyo acceso por transporte público es más complejo por 2 días a la semana. Esto es en el oeste y el suroeste de Filadelfia y en el norte de Filadelfia y en las áreas del noreste de la ciudad. Les ofreceremos el Servicio Comunitario de Transporte Especializado, o CCT, como pases de tránsito de SEPTA también. Hay más detalles que pueden encontrarse en el comunicado de prensa al respecto. ¿Qué deben hacer las personas que desean vacunarse? Primero deben registrar su interés en fila.gov/vaccine interest. Esta página de registro está disponible en español. Si usted no tiene internet, llame al 311 y un operador podrá ayudarle con el registro en varios idiomas, incluyendo el español. Si usted vive en zonas con códigos postales designados, y esto solamente dentro de Filadelfia, y es elegible por edad, es decir, es mayor de 65 años de edad, o tiene una condición médica de alto riesgo, no necesita sacar cita. Un recordatorio, las afecciones médicas de alto riesgo más comunes son las enfermedades del diabetes, la obesidad, que representa un índice de masa corporal superior a 30, y estas personas pueden asistir a los centros de vacunación cualquier día, desde el día miércoles 17 al día lunes 22 de marzo, de las 8 de la mañana a las 5 de la tarde. Deben traer evidencia de su dirección, como por ejemplo una identificación o licencia de conducir, una factura con su dirección, cualquier pieza de correo donde se especifique que usted vive en la zona designada. También la identificación de la ciudad de Filadelfia, el PHL City ID, se acepta en estos centros de vacunación. Si usted vive en Filadelfia, pero no en las zonas de los 22 códigos postales designados, se le ayudará a ingresar a la base de datos para programar una cita en el futuro. Si usted no es residente de Filadelfia y no tiene una cita, se le rechazará cortésmente. Probablemente debe esperar al aire libre, por lo que le sugerimos venir vestido y preparado para el frío. Si el sitio tiene una alta demanda de personas, es posible que le pidan regresar otro día. Con respecto a la orden de más seguro en casa, ayer el gobernador Wolf anunció la flexibilización de las restricciones a partir del día domingo 4 de abril. Se permitirá la venta de alcohol en restaurantes sin que se incluyan comidas. Se eliminará el toque de queda desde las 11 de la noche para los restaurantes. Se aumentará la capacidad de comer en interiores al 75% si se autocertifican a las precauciones de seguridad. Se sigue, sin embargo, fomentando las cenas al aire libre. Los gimnasios, teatros, centros comerciales, casinos pueden ahora admitir personas hasta en un 75% de capacidad. Y se aprobarán eventos en interiores con un hasta el 25% de ocupación. Los eventos al aire libre con una ocupación de hasta el 50% si es que la distancia es de 6 pies entre las personas. Nosotros seguimos preocupados por las tasas del COVID elevadas y que estén posiblemente en aumento. Revisaremos el anuncio del gobernador y determinaremos las restricciones apropiadas para Filadelfia en pocos tiempos. Para finalizar, tenemos muchas razones para ser optimistas durante los próximos meses. Pero hoy la epidemia continúa aquí y sigue siendo mortal. No bajemos la guardia demasiado pronto. Usemos una mascarilla, mantengamos la distancia social y evitemos estar cerca de otras personas, porque solo juntos podemos superar este gran reto. Muchas gracias.
All of those translations of the many speakers that we had today. And thank you to all of you who have hung in there. And we will be back with another briefing next Tuesday. Thank you.